All right, Sarah, I think we can go ahead and get started. Has everybody been let in that's there? Okay, great. Well, we will go ahead and get started. Thank you, everybody, for joining us this morning. I'm Jackie Johns, and I am a member of the OSPA crisis team. I'm also the president-elect for OSPA, and I'm a certified school psychologist at Collinsville Public Schools. So I just want to thank everybody for spending their morning with us. I'm excited. We have a good, I think it'll be a really informative presentation that Dr. Erika Olinger is going to give to us here in a minute. Just want to remind everybody, I know everyone's probably really used to these Zoom meetings by now, but just some of the housekeeping things. If everybody can make sure that you're on mute when you're not talking, that would be fantastic. If you have any questions, go ahead and put those in the chat box, and we'll have people monitoring the chat box throughout. And also, if you want to go ahead and sign in, you can do that in the chat box as well. Put your name, where you work, what your job is, so that we know who all is here with us today. So I'm going to let everybody on the crisis team introduce themselves. And one of our members, Catherine, is not here today, so she was not able to join us. So we'll not have her presence. But Trisha, do you want to introduce yourself?
Hi, everyone. I am Trisha Goga. I am one of the crisis team school psychologists at the Oklahoma State Department of Education. I'm a nationally certified school psychologist and a member of this committee, and also OSPA treasurer-elect.
All right, Sarah.
Hello all, I'm Sarah Rich. I am past president of OSPA, and I work at OSU Center for Health Sciences in our outpatient behavioral medicine clinic, and I'm happy to be here. Unfortunately, I am double booked at 11, so I'm going to have to sign off early from here, but it's good to see everyone's faces, and thank you for joining us.
Thank you, Sarah. And Erika.
Okay, well, good morning and happy spring to everyone. So happy to be with you here today and presenting in just a couple moments on ensuring safety in virtual space. I think I know everybody that's on, but I am on the OSPA board. I serve as both the NASP delegate and the chair for our crisis response team. I also, for NASP, I was very honored to recently be appointed to their National School Safety and Crisis Response Committee. So I serve specifically as a liaison between the Crisis Committee and state associations. And I work currently at the Oklahoma State Department of Education, along with Trisha as one of the crisis team school psychologists. So excited to bring this content to you today, and there is a lot of it, so I hope you all find it beneficial.
Okay, great. So Erika, you're going to start sharing your screen. That sounds great. I just want to say a couple more things to remind everyone. There will be an evaluation to fill out at the end, and I believe that Trisha will share that with people, put it in the chat box in order to receive your credit. And we'll be confirming attendance through Zoom tracking today. And then also just wanted to make sure everybody is aware of our upcoming spring conference on May 7th, which is Strategies for Student Safety and Success. So mark your calendars for that if you haven't already. We're excited about that. And I believe that Trisha will talk a little bit more about some of that, some of the speakers and topics, and the structure of the conference. We're going to have a virtual format and an in-person option. So I think Trisha will talk some more about that at the end as well. But I don't want to wait any longer to let Erika start talking about ensuring safety and in a virtual space. So we'll let her go on with that. And I am going to take my camera off because I'm getting ready to go get my second vaccine. So I'll be listening while also getting vaccinated. So thank you again, everybody, for joining us, and take it away, Erika.
Thanks, Jackie. Make sure you're on mute for the actual poking part, okay? So we don't hear your screen. That would be great.
All right.
Okay. All right, everyone. As we get started today, just a couple of quick things. First of all, before we go over these learning objectives, I think it's important for us to think about virtual space as something that is here to stay. And I hope that Jackie's joining the group and many are getting vaccinated. And I think there's hope on the horizon that schools will start to look more in person and go back to typical instruction for the majority of students. But I think it's important to recognize that the pandemic shouldn't be viewed as the time we did virtual learning as opposed to the time we really started virtual and hybrid and distance learning. Because I think for a portion of our students, virtual learning is going to be their preferred and continued method. There's going to be a group of students who receive education, I think, through a primarily virtual format. Second to that, I was on a meeting just yesterday. Now, it was a national meeting, not a state meeting, but on a national meeting, and there's schools already all over the country who are changing attendance policies to say, we're no longer going to have inclement weather days. And if there's other, the snow days are gone. And if there's other types of threat to the schools, like, okay, I'll confess, back in the 90s, when I went to high school, it was a rare year when there wasn't a bomb threat, real or perceived, for senior skip day, and we would all go home for the day. And what I think now will happen, whether it's a weather event, whether it's a true threat or a senior skip day threat, I think that schools will instead shift to virtual learning environments. So it really behooves us, even as the pandemic is wrapping up and most students might return to a traditional space most of the time, we're still going to need to be mindful of our procedures and how to operate in the virtual environment. So some of the things we're going to do today is, of course, just talk about the challenges of ensuring safety virtually and how that looks different than in person. We're going to talk specifically about some resources for some specific procedures that we might engage in as school mental health professionals or as school psychologists or as behavior specialists, things like suicide risk assessment, behavioral threat assessment, and then even things like mandatory reporting. And Tricia and I can tell you that we have had schools throughout the pandemic who've needed some very specific consultation and support in suicide risk assessment, in behavioral threat assessment, in mandatory reporting. And it's something that I would foresee other school psychologists needing to support your districts in as well. I'll be popping along and a lot of different resources that you guys can use to help when addressing emotional and behavioral support. And then if there's time, we always like to talk a little bit about the crisis team at the State Department of Education, where Tricia and I work, and some of the services we provide. And it's a fairly small group today, so I would love for there to be interaction in the chat and go off mute. I can't see the chat at the moment, but Trisha's going to be monitoring it for me, and I'll try to pause periodically, but you guys feel free to have discussion in the chat. Tricia will let me know if we need to go off mute and attend to anybody's needs, but I'd love for it to be quite interactive today. Okay, I also should just start off by saying that I'm giving a ton of information rather quickly, and it's really considerations and an overview. As school psychologists, as mental health providers, don't consider what we're talking about today to be thorough training in suicide risk assessment or behavioral threat assessment, or not even necessarily in mandatory reporting. I encourage you to do that. I think all school psychologists should get some structured and formal training to know how to do those things, because it is very specific in terms of procedures and do's and don'ts and other considerations for students. So if you haven't had that opportunity, we can give some resources for where to be formally trained in these types of procedures. But I also know many of you are already trained or you're already involved, whether you're trained or not, in making some of these decisions and serving on these teams in your schools. But just a disclaimer, I'm pointing you to resources. I'm giving you some things to think about. You're not going to leave like knowing precisely how to conduct some of these procedures. Okay, so to get started, let's just think about some initial considerations when we're thinking of distance learning environments, or what I will probably refer to as virtual space, and how ensuring school safety looks different than it did in our traditional in-building environments. And I don't have to tell you guys, there's EdSource put out a really comprehensive document where it surveyed all kinds of teachers and counselors and other folks, and we were caught off guard. Most people are saying, yep, I didn't get into education to interact through the screen, or I feel like I'm working harder than I ever did. Some things are working, some things aren't. So we know that education in a hybrid space via distance is challenging, because most of us were trained to think about delivering services in that format. So again, some of these are obvious. Some of the challenges we're facing is we can't physically see or speak with students. difficult for instruction, but as we're thinking today, difficult then for understanding issues related to safety, being able to physically see indicators for abuse, being able to talk to kids in person about their suicidal ideation. So that's a challenge. It's also, I think, just for most people, more difficult to establish and maintain those relationships with students and with your colleagues. I love getting on and seeing all of your faces on these Zoom calls, but it is sure different than if we were in person and having conversations and I was able to give you a hug and check on you and visually see you. Difficult to monitor behavior. I know many of you are working with students and maybe some staff with some unruly behavior, and it's just more difficult. We weren't trained to, I mean, at least I wasn't trained to be doing, frequency recordings via Zoom. So that's difficult. Student engagement, and particularly for some students who are most at risk, engagement is a challenge for us in the virtual environment. And then there are certain groups that, maybe previously had some characteristics that necessitated that they needed more services and more supports from schools. So clearly some students in special education, students living in poverty, other disparities, and virtually now they're faced with more challenges due to connectivity, or they have certain conditions that make the virtual learning space difficult or impossible for them to participate in. And then and we'll talk about this all throughout the day, specific adjustments for students who have significant mental health concerns and behavior concerns. I would also say I don't think I listed it here, but challenges to delivering things like social emotional learning virtually, something we would usually want to do in person because we typically think of social and emotional skills being interpersonal and interactive, and it looks different in our space. And I'd encourage you guys to list any other challenges that you think I forgot there in the chat box. But also just thinking about specific to virtual space, as if all these things we're talking about wasn't enough, data that there's a significant increase in online predators. So, attempts at human trafficking. I was on a webinar last week that talked about ransomware, so essentially people holding teenagers, nudies, ransom, and they want money or they're going to release it to the world. And I'm talking teenagers. Cyberbullying is huge. I think that's something that there is a lot of research going on now, and another tool that as school psychs will really need to be well versed in addition to our traditional anti-bullying skills, sexting and other related types of behavior that we're seeing in students that, again, many of us may not have been trained in interventions for things like sexting and other online behavior that we maybe didn't feel was part of our wheelhouse being in the school, or that we just didn't know we'd have to address in the same way. And then I don't know that any of us were free of being on a Zoom and being video hacked, for example. So in addition to the things I mentioned before, then there's this whole complete set of considerations specific to online space that are affecting students and staff in ways we didn't imagine. So what does that mean for us as school psychs and other mental health providers? It means clearly we have to rethink how we're delivering our SEL and mental health supports in the context of layered crises. So again, the pandemic may be coming to an end, but we also had the concurrent crises of racism, civil unrest, the election, other types of stressors that added that will likely not be fully dissipated even in the fall when we start next year. We need to develop new skills. And so we're a profession that's always learning, I think always refining what we're able to do. And we're going to talk about some new skills that we all need to be mindful of developing to address the needs. And some of our procedures are really good. And, we had threat assessment down, man, and we were really good at it in person. But some of the things that we were trained in, that we've practiced, we need to significantly modify to meet the demand. So that's what we're going to talk about today. This next section I'm going to go through rather quickly because they're more generalized ideas that school psychs may or may not be involved in, but I think it's important to talk just in general about some practical ideas for virtual safety before we get into the heavy stuff. And the first thing I believe schools need to do is address what I'm I'm going to make the parallel between like physical safety and psychological safety. So in prepare trainings, when Trish and I are talking to schools, we talk about safety has two faces. There's physical safety. We have to keep kids physically safe. We have to balance that with psychological safety. So typically when we're doing prepare, we're talking about physical, meaning the school building. You need to have doors that lock. You need to have access systems. But now we need to think of that same idea, physical and psychological safety within a virtual space. So digital safety, I would think of, you can think of that as what are physical safety measures. So that's things like we need to be teaching kids things about ideas around password security, why we don't share personal information, that things that are on the internet are on the internet forever, that there's a reason that it is unsafe to share those needies or whatever it happens to be in that personal information. And that needs to just become an integral part of our conversation, and not just in our computer science classes anymore. I have a 6 and 7-year-old who started the school year as a 5 and 6-year-old who I'm having to talk to about digital safety because they're on devices that I didn't imagine they would be on for several years yet. So this needs to start young and be developmentally appropriate. It needs to, like we have other safety protocols, we need to have a digital safety protocol. And I'll talk a lot too about getting students involved in all of these processes. For one thing, there's going to be more buy-in if they're involved with these, and they're going to feel more ownership if they're part of it. Also, kids are the ones that can tell us where they're hanging out virtually. Okay, they're the ones that are going to tell us what's the latest app or what's the latest feature on this app that we've had forever. And so kids need to be involved to tell us that. And it's no longer okay to just assume your tech department's going to block the malware and block the naughty sites. That's no longer sufficient when we're trying to ensure safety for our kiddos. Also, we should have curricula that specifically address for students and staff some of those big deal things I was talking about. So we talk about health concerns at the developmentally appropriate level. I would advocate for these are health and physical safety concerns. So we need to have curriculum and instruction around how to spot online predators, how to prevent cyberbullying, sexting, all of those things. And what I've added to this slide is these also, though, then have to be prepared with reporting mechanisms. So if this is happening, where do I go for help? If this is happening to a peer, how do I tell an adult? So not just talking about the dangers, but we're good school psychs and we know let's pair that and match that with some appropriate intervention and giving kiddos ways to advocate for themselves and for their peers for safety. It's different when you can't go up after class and whisper to the teacher, hey, Sarah said some things that were really concerning to me and I think she might beat up Trisha after class and I'm really worried about her and she's really bullying Trisha. And you guys know I can pick on those two for that example, but we have to be thinking through these traditional systems and how do we adapt that. Now, the second piece I talked about was that psychological safety piece. So I would think of digital security. Some people also call it cyber hygiene. That's what my husband calls it in his world, is that physical safety piece. Digital citizenship then is that psychological safety piece. And teachers have been doing this in my observations pretty well during the pandemic. But that's things, this is applying PBIS to the digital space is essentially what it is. Let's create some expectations and some etiquette. Let's talk about rules that apply both at school and online. So things like confidentiality, and we're not going to say certain words and we're going to behave in certain ways. But then also thinking through in our behavior matrix, let's add a new location that says virtual and talk about what our expectations should look like. So it might be things like no side conversations in the chat, no taking screenshots without permission, etc. And again, making sure that parents, the same way we want them to have access to our PBIS resources, would have access to our virtual resources as well. And that seems like fun to me. That seems like a fun addition to what PBIS teams could do. And then also just creating safe spaces virtually. It would be the same way we're encouraging teachers, and we know the data is clear about how meaningful relationships are, creating virtual relationships. Small things, and I meant to do it today and I forgot, but even small things like adding the pronouns at the end of your Zoom title that's the same and another respectful way that we're encouraging in person. It feels like a small thing. That's creating a community where kids feel safe to join, safe to learn, and safe to contribute. For some students, and this would include Erika Olinger today, allowing the use of virtual backgrounds. I would be very embarrassed if you guys saw my guest room behind me because my kids destroyed it yesterday, and you would think, oh my gosh, how does she have so much laundry piled on that guest bed, for example? And so if it makes students feel safe to not have to respect their privacy of where they may be or what may be going on in their home, I'm going to balance that knowing that that's dangerous too. I know sometimes that means we can't see things that we'd like to see, but teaching them when it's appropriate to use virtual backgrounds, for example. Making sure that we are finding ways to look at regular mood and temperature checks to assess social and emotional needs. So I'm thinking of, if you're in a classroom, teachers, and if we're doing observations, we can scan and say, oh, that's a trigger for Jackie. I can see her getting mad. She's clenching her fist. And we know how to, spot those antecedents and other triggers so that we can intervene. Or, oh man, Catherine's sleeping again in class. I'm really worried she may be depressed. We should probably call a team meeting. So we need to find a way to check in with students and with parents. And again, even for students to be able to report on their peers. And there's fun ways to do that. So we can do the emojis. We can say, put one word in the chat that describes your mood today. Send me something privately that tells me about your mood today. So thinking through how can we mimic that visual and physical scanning that we used to do in classrooms. And then to the extent that we can, doing things like disabling any type of functionality that would lead to bias or online bullying, particularly in those places we find that's occurring. Other things that we need to do, and I mentioned this earlier, is making sure we're very specifically giving students virtual ways to report concerns, multi-method, multi-people. They may not be, Trish and I were having a discussion yesterday, it's an uncomfortable one, but about teacher bullies. If students are only around their one teacher on Zoom, they may not have the opportunity to walk down to the counselor's office and report something that's happened, or to stop the principal, or even to have that conversation with the cafeteria worker, that nutrition worker that they have a relationship with. So it needs to be multiple method, not just private chat your teacher if you have concerns. We can do that through apps. We can do that through, many schools have adopted their own reporting systems. We're happy that the State Department of Education, in partnership with some other agencies, now has a statewide see something, say something, do something campaign. So anybody, student, staff, parent, counselor, school psych, anybody, community member can just text OKS threat to 226787. Save it in your phone right now. And there are people who will respond to that threatening behavior. Now, for the most part, it's looking at those, what I'll call big deal threats, like a homicidal or suicidal risk, or we're worried somebody's going to come and do harm to the school. However, it's monitored. And so if they do need to contact a principal, contact a school psych, contact a counselor, even about something that seems smaller deal like bullying, they will do that. So that's one resource that we're happy to have. There's also a tip line number, and the website is tipline.ok.gov. So just some examples of giving teachers, students, avenues to advocate for their own safety. Also, and this would be a fun thing for us to do as psychs, creating those same types of virtual social groups or communities. I know many of you sit down and you have your lunch bunch, and you have those 3 or 4 students that come and have lunch with you every day as part of their check-in, check-out procedure. Or you always go and check on Miss Goga's class at 11 o'clock. So try to create those same types of social connections, check-ins with adults, so that kids are connecting with you as adults, with each other. And also sometimes those more informal and natural environments, while we're talking about safety, is really where we see concerns of safety. Students may, for example, be more willing to let their guard down if they feel like it's a more informal space as opposed to a learning or instructional space. So for those of us concerned with safety, we find those less structured places is often where we are able to spot and intervene on student concerns. And then the last, as we're just rounding out this kind of basic thoughts before we jump into some more specific procedures is, to the extent that you can, try to keep up with technology. And it's tough. It's tough to know what is the latest app out there. What are students accessing? I have a hard time myself with just like text lingo, like I thought WTF was, wow, that's wonderful, for many years, for example, right? So I even have a hard time with that. But to the extent that you can, keep yourself up to date with what kids are doing and where they're hanging out. Again, I was a child in the 80s and 90s, and our teachers knew which corn row we were going to go and have, not me, never, but which corn row students were going to gather on over the weekend to get into trouble and have typical teenage fun, although sometimes dangerous teenage fun. And so we still need to be doing those same types of monitoring activities. It's just kids hang out virtually now instead of in person. I'm going to have Tricia drop a resource in the box now, and this is from the Readiness and Emergency Management for School, or REAMS, and it is just a nice document on cyber safety fact sheet, and it will talk through in more detail and the things we've discussed so far and give some more information. Okay. Tricia, before we jump into the more specific suicide prevention and assessment, was there any comments I should be mindful of or questions in the chat?
No comments or questions right now.
Okay, well, you guys send them there if you have them, please. So kind of beyond the basics now, one of the things that I want to talk about, and this could of course be a full 2 days in itself if we were fully being trained, is this notion of virtual suicide prevention and assessment. And the sad news is, in our own state, also nationally, and of course the data hasn't been officially published yet for 2020, but anecdotally, Tricia and I can tell you that most of our direct crisis responses that we know about, that we've been contacted about at the State Department, have been for student and staff suicides. And our youngest was a 5th grader, all the way up through staff who'd been in schools for many years. So it's a reality and it's increasing. And we might, we can draw some conclusions, and the research will tell us about, is that related to the pandemic? Is that related to isolation? Is it related to the unpredictability of the virus? We don't know for sure yet. But what we do know is that we need to be mindful as mental health professionals that suicide is on the rise, and that we need to be able to assess for it, prevent it, and provide resources in the virtual space. So I would encourage you, and at the end, or I guess you can do it now, Tricia, if you'd like. Some of the things I'm talking about is, of course, from materials developed by Dr. Stephen Brock, Richard Lieberman, and colleagues, who within our profession of school psychologists are leaders in suicide prevention, intervention, and postvention. I would also point you to any materials developed by Dr. Scott Poland as well, who's done suicide research for many years and who's kind of a grandfather to me in my own crisis learning journey. But they developed fairly early on into the pandemic this comprehensive school suicide prevention in the time of distance learning document. Also, NASP, they do provide free webinars. They're called Ask the Expert webinars. And of course, they're going to do much more justice talking through their tools today than I am. But I did just want to give you some thoughts for consideration. So in addition to the larger document, the comprehensive school suicide prevention document, that one's long and pretty meaty, they did give 2 checklists, the prevention checklist and the intervention checklist, that I think you could find beneficial today if you were called to do a suicide risk assessment. And they're meant to be comprehensive enough to be useful, but they are true check sheets that school psychologists, school counselors, others could use to make sure they're getting their bases covered as part of suicide risk assessment and intervention. And so Tricia's going to drop some of those things in the box at her leisure as we talk about it. So the larger document, again, is rather lengthy, but it goes through some important considerations for how do we engage in our prevention work in the virtual space. So it talks about basic assumptions It talks about virtual service delivery platforms. Again, my sense is that most of us on this call weren't necessarily trained in virtual service delivery. And we've had to learn as we go and build that plane while we were flying it. But now moving forward, since the virtual space is here to stay, those skills need to be part of our repertoire. And we need to have the platforms and the tools to do that. Similarly to not just the platform, it gives some telehealth considerations. And it talks through all three complementary pieces of suicide work, which is the prevention piece, the intervention piece, and then even the postvention piece, which again, unfortunately, Tricia and I have had to give many postvention interventions to districts virtually. We haven't been able to go there and provide response to a team, to a staff, to students in the same way. So handy resources, that's just a picture. I know it's kind of blurry probably for you, but of the intervention check sheet and the intervention check sheet. So again, they're meant to be useful, but not as wordy. They're meant to be, I've got to talk to this kid, or I've got to help this team. What do I need? And so they've made these accessible check sheets for you. I'm just going to talk about some highlights that are further discussed in these documents and in the webinar, but one of them is, we do need to sit down, if you haven't already, especially now that maybe some of us are able to take more of a breath, and look at our intervention policies, our procedures, our protocols, and revise them to include our telehealth and distance learning components. So that just needs to be something that schools are revisiting right now. And then in addition to that, training our school staff members, what are the procedures to follow? So anytime I was in a building, teachers could walk down to the office, or they could call me on the intercom and they could say, Erika, I'm worried about this student. I need some help right now. And I could go immediately, the counselor, the administrator, the SRO, whoever needed to be there could physically run down the hall or bring the student down to our offices and intervene. And so often school staff had access readily to those professionals who could help them when they saw students engaging in suicidal behavior. Now we need to teach them what to do about what if they're on a Zoom and they're the only adult on the Zoom and they have concerns about some schoolwork that Jackie turned in or some comments she's making in the chat box. And do we have a procedure in place for how we're going to replicate that immediate response from our mental health providers, our law enforcement, and our administrators? So again, in the documents, they give some guidance towards that, but I think it's really important that schools have that in place because we've seen the need for it. And I don't think teachers know without our direct instruction how they should be responding. Along with that, of course, would also just be what to look for. Oh, which happens to be my next bullet point. We need to talk about what are risk factors and warning signs associated with suicide look like, and what should you be mindful of in language in your classroom, in assignments, in conversation, in imagery, if you see something on social media, and also bring their attention to, again, because of the pandemic, because of civil unrest, because of many stressors right now, not only do the signs look different, but the potential for suicide, unfortunately, is greater. So we need to talk about that. That needs to be part of our conversations. And then again, giving them resources, access, procedures for if it's an immediate risk, it's okay to stop the call, stop class, and call 911. Or here's our school number, and you text this right away, and a school counselor is gonna get on your Zoom and help you. But think about the amount of planning that takes, that the counselor knows, okay, which Zoom do I hop on and which class? So being mindful of those procedures. Also knowing how to conduct a wellness check. And I think I talk about this in our threat assessment piece coming up, but it's interesting that many law enforcement professionals, including school resource officers, were reassigned during the pandemic because they didn't physically have buildings to go to. So as buildings start to open up, they may be coming back, but just thinking about how do you request an SRO when you're online? And if a student's suicidal, it's not appropriate to just be like, okay, well, I'm going to kick them out of class. If they're being disrespectful or using foul language, you can put them on mute and turn off their video as the host and go about your day. That's never something we would want to do for students who are potentially suicidal. Nor would we necessarily want to expose the other students in that virtual space to the trauma. Oh man, so many things to do, but that does mean that as mental health professionals, we need to be teaching, learning, engaging in what are telehealth skills and resources. So I've had to relearn how to do suicide risk assessment. I've done it for years. I now have to know how to do that in a virtual space and how to develop those interventions virtually, and through different options as well. Also, another thing that school teams were finding is that, again, before, if Trisha had some suicidal ideation, I could go and pull her IEP if she was on one. I could look in her cumulative file. I could find the information I needed about Trisha to say, okay, does she have a physician? Do we have a record of this? What's in her behavior plan? What's her crisis plan? And of course, virtually access to those records, which were largely physical records, has been difficult. And not everybody has access to Ed Plan. So even those records that are already electronic, do the right people have access to those records? So building conversation and procedures around that. And then just like anything else we do, as we're reviewing, we're updating, we're looking at these procedures and these policies that schools have. You better make sure your legal counsel is looking at those. And so I think so far, largely there's been grace, there's been flexibility, parents, communities, the world has understood that we were making things up as we go, but I see that grace and flexibility closing as time goes on. Now there's no excuse for us not to have virtual procedures and policies. And so it would be devastating on top of the tragedy of a suicide then for school districts to become liable or individuals become liable because we didn't develop procedures. And I always just call it like I see it. I see that as a real threat because schools get sued all the time over suicides even before virtual learning. And so important to take these considerations into place. So previously, all of these previous slides, we were talking largely about the prevention piece. So this would be things that you can be doing in those, extra days in the summer, as if you needed Erika Olinger to give you more to do, but things that you should be thinking about as you meet with your crisis teams and your administrators and you're engaging in this work, or things to bring to their attention. I did do this presentation a couple weeks ago for the School Counselor Association here in Oklahoma, because I do think this is a team approach. I'm not saying you as a school psychologist has to do this work, but it might be you who brings it to your crisis team's attention. As far as intervention tools, there have been some screening tools for suicide developed. Oh, Trisha, I didn't give you these exact links, but they're on the document that Trisha is going to provide for you. And so using those in addition to some of the physical screening tools you may have had before. Again, a lot of our known procedures for risk assessments, for those of you who've had to conduct them in person, it's different now because we don't have the same body language. We might have caregivers sitting in the background, and so students don't feel safe to be as vulnerable as they would before. So just thinking through, can we provide safe avenues and safe ways? And you might have to learn how to do a threat assessment via chat. That's uncomfortable, via a text message instead of talking to students. Never how I would prefer to do it as opposed to face-to-face, but a new skill that perhaps gives them the safety and you the information you need to make those difficult decisions. Also, just knowing, does your reporting mechanisms, I talked about schools have adopted a lot of apps where students can report out, but we don't know where students are and where their caregivers might be in the same way that we did before. Is your student logging on to class from the neighborhood park? Are they at a coffee shop? Are they at home? So we used to know they're at school, and the protocol most of the time was they stay with me or they stay with that SRO until the mobile crisis unit arrives or until mom arrives ready to take them to St. Anthony's or whatever it happens to be. But now, how are we going to keep those students with us virtually and send the appropriate help to where they are. So just thinking about, making sure that iPads, there's not the ability to disengage the geolocating or those types of pieces, or making sure that early on in your protocol, your question is, where are you right now? Can you shoot me a pin? Which was never part of our procedure when we were in person. And then also just even thinking through, what does consent look like? And as we know, in emergency situations, you don't necessarily have to have consent. And I would argue that our threshold has actually been lowered. And so it used to be that if I felt a student was at risk and I finally determined, okay, Trisha, I'm going to have to call the mobile crisis unit now to get you the support that you need, and I'm going to stay with you. It used to have to be pretty high, but now it's harder to tell. And so I would call earlier in my sequence if I felt there was any potential that Trisha was at risk. So it used to be, I'm not going to call for help unless it's moderate or high risk. Now, even if I feel that a student is at low risk, my threshold might be lowered, if that makes sense. Okay, I'm going to take a quick drink. Trisha, anything in the chat? Or people can go off mute. We're a small group if you have something to ask or to say.
There is nothing in the chat so far. So if there's anyone that would like to speak up or ask a question or has a comment, this is a good time to do so.
See, talking about virtual space, you guys are either riveted and like glued to your screen and just in so much awe you can't speak, or you're asleep, or more likely you're multitasking with email. Let's be honest about that, and that's okay. I do want you though to ask and discuss, and feel free to make comments, including your concerns at any time. Okay, we already talked about making sure you can access digital student records. You also might need to rethink your procedures for contacting supports. So how are you going to contact those mobile crisis units and send them where they're going to go? How are you going to contact law enforcement in those situations where you need to do that? How are you going to gather the team virtually in a quick fashion for those times that you need to do that? So thinking through those types of procedures. Also just thinking about, typically, not always, but typically when I was in schools, if I was talking to a student and I was conducting a suicide risk assessment, I was usually me in a private space with the student, but I had the SRO on standby, or the school counselor or the administrator, so that I could, give 3 knocks on the wall or shoot that text indiscreetly and they could come by, discreetly, not indiscreetly, discreetly, and they could come by. So how do we mimic that? It's a little bit harder for the student to feel like they're talking to somebody privately if they can see the other person's name on the Zoom, right? So how do we mimic those same procedures? And it might be that that person isn't on the Zoom, but we have them on the ready via text. One district I spoke to recently had a procedure where they weren't on the Zoom, but they were on a cell phone and they were on speaker. So the second person was there listening and could go ahead and call the mobile crisis unit if something came up without the, in this case, school counselor interrupting the flow of talking to that student. And then how are we now going to deliver those student and parent support resources? I visited a school virtually, and I loved that before class started, they just had a running banner on there. I think they used Google Classroom or something, not Zoom, but on the banner itself, it had the suicide help hotline. It had some infographics about cyberbullying. It had those resources running as part of the screen. So think of those same visual reminders. If we were in a school, we'd have posters on the wall. We would have reminders hanging by the water fountain, whatever it happens to be. So not just notification of support resources, but how are you going to run some groups? How are you going to do your check-in and check-outs with those students? And what is that going to look like virtually? And then just reconsidering our multi-tiered systems of supports for suicide prevention, intervention, and postvention. So rethinking through not just our matrix, like we talked about earlier, but our matching interventions. So do we have virtual interventions and virtual supports we can give students who are at low risk? How does that look different for the students then who are at moderate or at high risk? How do we bring in our community partners? Now, in some ways, honestly, this has become easier because it's easy for communities to all partners to all click on a Zoom link. That was just this week, Trisha. We were on one earlier this week where I had the local police department, I had 3 mental health agencies, I had district personnel, I had building personnel, I had everybody in the same place on a Zoom. So in some ways that we were immediately able to mobilize and get all the seats at the table that needed to be there, the virtual table. So in some ways that's nice. And then also rethinking reentry planning. I know a lot of schools have this policy, and we can talk about the appropriateness of this on another day, about students who were suicidal cannot come back to school, for example, till they've had a release from the hospital or physician. So are we going to do the same thing in a virtual space where we're going to kick them off if they try to join the Zoom? Or how are we going to provide supports and talk to that continuity of care and those wraparound services when they're starting to come back? So all things to think about. And what I think this really speaks to me and some of the administrators across the state I've spoken with is your crisis team needs to practice. So you need to have some tabletops. You need to talk through. You need to have some drills and some tabletop activities as a crisis team, as a mental health support team for what this is going to look like. And again, this would be a good summer activity, pre-service school activity, end of the year, this year activity, to help guide some of these policies and procedures we've been talking about. If you need help for what that looks like, of course, you can contact the crisis team at OSDE and we have support for you. Okay, anything on suicide, Tricia, before I jump into behavior threat management?
No comments right now.
No comments. Okay. And I know I'm throwing a lot at you. And one of the things I'll encourage you now and throughout is that these aren't things you need to solve tomorrow. They're not things you need to solve by yourself. I want you to think about your role, where you have influence, where you have responsibility, and think about 2 or 3 things you can change to start. So, you know, I know about behavior change, and we're not going to change all of our policies, all our procedures, and have this perfectly in place by the end of next week. And that's okay. What I really just want you to do is to be thinking about the implications and the changes and the considerations we'll have to make as school psychologists in this work. So shifting gears just a little bit, the next kind of big chunk I want to talk about is behavior threat assessment and management in the virtual environment. So behavior threat assessment, that includes suicide intervention and includes risk assessment for suicide. But then this is, of course, those students who make threats of harm to others as well as harm to themselves. So I joked about the bomb threat. You know, there are bomb threats and there are credible bomb threats. Schools receive threats about students who are going to do harm via mass means, you know, planned school shootings, for example, or some kind of intrusion of that nature, all the way down to threats like, I'm going to slash that teacher's tires, or I'm going to beat up Trisha after school. So small threats are still credible and big threats can still be credible. And the threat itself can be towards oneself or others. We spoke about specific guidance for suicidal ideation and suicidal threats. And there's a whole different set of procedures perhaps than what would fall under behaviors of harm towards others. So that's what this next section is about, behavior of harm towards others. Similarly, this guidance, also from NASP, was put together fairly early in the pandemic and is being revised. And it's from my colleagues, Dr. Christina Conley and Dr. Melissa Reeves. Those are probably names that you've heard if you know about crisis management, and especially for, well, both of these individuals and the whole team, it's their bread and butter and research interest to look at behavior threat assessment. And Trisha's going to drop in the box for you again these resources and where to find them on the NASP website. But pre-pandemic, they were crafting and making best practices for behavior threat assessment. And then again, they kind of adapted it to what they're calling COVID-19 and what I'm just going to think of as virtual learning from here on out. Also, you'll notice that they also say behavior threat assessment and management. And I love that they do that. And I think that falls in line with what we know as school psychologists. is many teams right now, very well intentioned, but they know how to do the assessment part and determine, okay, is Micah Shelton a risk or not? And they can come to a determination of that was a credible threat or that wasn't a credible threat. And then they think that the work is done. But there's Micah, she's coming on to threaten me right now.
I'm coming on so you can visually see I'm not
Thank
a threat to myself or you.
Okay, thank you for that. Thank you for that check-in. Everyone give me a thumbs up if you're feeling like Micah's looking really good today. Every day, every day. But the management piece is important because no matter whether we determine they're a low risk of true threat, a moderate risk, or a high risk, the assessment itself isn't the end. Then we need to determine how do we intervene with that. If Micah made a threat, even if we consider that she's low risk, that's still an indication to us that she needs support of some kind. She said something concerning because either she didn't feel safe, she's feeling bullied, she's got some trauma going on at home. And so in the same way, we wouldn't conduct any kind of academic test and say, okay, that's it, thanks. We follow that up with appropriate matched intervention. And I think, I don't know if you guys see this in your buildings, but I feel like that follow-up piece is missing unless kids are a high threat. And even if they are considered a high threat, then the follow-up is, okay, we'll suspend them, or we'll pretend like that's not going to be a problem, or we'll just put them on virtual learning now so we don't have to worry about them. And that's not truly intervention in terms of supporting student wellness and the concerns that they're presenting to us. So let's start with just I've already mentioned some reminders overall about threat assessment. So school safety is everybody's responsibility. And I love that most of the reporting mechanisms now allow for, the quality ones anyway, allow for students to say, I don't feel safe, staff to say, I don't feel safe, and administrators to say, I don't feel safe. Anytime there's a really tragic incident like a Columbine, like a Sandy Hook, any of those types of incidents, we can learn afterwards about things we could have done differently. So as tragic as they are, they do feed this work and feed crisis work in that it tells us what could we have done differently. And one of the things we've learned over time is that a lot of times, even students that were carrying assault rifles from parking lots into buildings, for example, people saw them. In some cases, like security officers saw them, but they didn't feel like they had the right or the capacity, or it wasn't their place to do anything about it. Now the best practice is if Trisha feels unsafe as a teacher, she can push a button on the app and put the building into lockdown. If she looks out the window and she's the first person to see it, she doesn't have to have this communication chain of, I'm going to call the office and report it, and the secretary is going to find the principal and tell him, and then the principal is going to go ahead and find the SRO and ask what we need to do. Like, now we're giving people the capacity to respond in some of those high profile situations. There's no profile of a student attacker, so that's hard to convince people about, but the research is pretty clear that it's not based on physical characteristics, and that's why we call it a behavioral threat assessment. Behaviors can indicate for us that somebody's a true threat, but what they're wearing or what ethnicity they are or what music they listen to is not an indicator. Behavior is what we have to learn to look at. Again, the good threat assessment behaviors, those provided by NASP, and also, by the way, from our own Office of Safety and Security at the State Department of Ed, teach those doing the work how to evaluate a student's communication behaviors and within their stressful context and support systems and resiliency skills. So if you feel like you'd like some additional training or you want your building to, again, NASP has resources and training. You can pay Cigna and others lots of money, or you can go to the Office of Safety and Security, and they've adopted John McGrill's curriculum. He's a school psychologist and he does good work. And so they can train your staff or train you in some of these procedures. But it is something that you should have a process in order to engage in. And I would also advocate for a team approach to your threat assessment and management. It shouldn't just be the school psychologist or the counselor or even an administrator. It's another set of procedures where there should be a team approach. We also know that there are certain school climate indicators or specific student group behaviors that are more likely to lead to credible threats. And so that's if you have a building where there's a high level of bullying, harassment. I say isolation, disconnection. Again, we're all disconnected somewhat because of COVID-19, but if that's increased even more so because of the virtual space, and then effectiveness of your prevention efforts, but I should add on there suicide and violence prevention efforts. So there's other data that can about your school and about your districts that can help tell us about other places we could be involved in prevention work. The goal of threat assessment is not to determine if a student posed a threat. Many of us can pose a threat. Many of us do inadvertently every day. There's probably times that I have said things like, I could kill my husband for not doing the dishes again today, right? So anybody can pose a threat, and that's common. The art of the behavior threat process is determining if they, anyone can make a threat. Take that back. Anyone can make a threat or state a threat. The beauty of a behavior threat assessment is that a credible threat, or are they truly posing a threat? Either way, we need some intervention. Either way, Erika might need to learn to change her language to say, even in joking, killing my husband isn't funny and isn't appropriate. So just because a student isn't posing a threat doesn't mean that they don't need some level of intervention to address that behavior. Okay. Another great place to look if you're new to this work, or if you just need additional resources, is this handy document. And it was a collaboration between the US Department of Ed and the United States Secret Service. So lots of collaboration work there. And you'll find Melissa Reeves quoted in there throughout. But they, along with the National Threat Assessment Center, created this operational guide. You'll notice it came out pre-pandemic. So I imagine there'll be some changes, but in terms of just best practices in threat assessment, this would be a guide for you. And what I like about it is that it also tells us about resources and supports post-assessment. So think about your team. Again, similar to suicide assessment, you're going to have to think about how are your community and partners going to be involved. And then we're going to have to do some work about what behaviors look like. So a common example in Oklahoma that we've seen is that it is not okay to bring a gun on a campus physically. That's a behavior of concern, and we're going to work with that. However, it's not against the law to have a weapon at home. So how do we make the distinction between, you know, Michelle comes from a family that likes to go hunting and they have their shotguns hanging on the back wall, as opposed to, oh, this is a true threat. And so, and how do we talk about that? And maybe it's that our expectation is that students don't sit where they're visible, you know, or if they are visible, what that means we're going to have to do in terms of action. In the same way as if you bring it to campus, here's our rules for what we're going to have, the procedure we're going to go through, with whether it was accidental or not. But thinking through some of those things, it used to be a very clear threat, or at least a very clear indication of needing a threat assessment, versus this is the home environment. And similarly to all the things we've talked about so far, is what is school staff to do when they see this? They can't just call Erika and I'll come down from my office and get that student. What's a parent to do? Who are they supposed to call? And are we consistently and regularly providing those resources in different formats? And then again, same thing with our students. Do they have mechanisms? Do they know who to contact and how? And do they have the capacity if they feel threatened? Something I'll talk about here too is, this is true, this has always been true in threat assessment work, but with our reporting systems and other things, we have to look at that through an eye of culture and trauma and tradition, right? Because you all have students who will tell you, yeah, snitches get stitches. And that's a very real thing. Like, even if I feel unsafe or I feel like somebody's threatening me, I'm not going to be the one to contact the teacher. I'm not going to use that app. And so thinking through different ways that you can make students feel safe, different people they can connect to, different people who are checking in on them. And again, not just assuming, well, we have a say something, do something app, so we're covered. But are your kids using that? Do you have data to indicate that your students know how to use it, that they are using it. Something to think about. And just like any other thing we might try, it's fine to put something in place, but don't assume it's fine. Take some data on it. We talked about the SROs. We talked about making sure teams can access student records. And then this is another place where you would need to rethink your consent procedures for talking to mental health, medical practitioners, and potentially law enforcement as well. You might also have to beef up your, again, just like we used to have physical monitoring and we could visually and through other ways monitor students, we might now have to assign folks or send a rotation for folks to the extent that we can to monitor social media. That's where kids are hanging out. They were hanging out there honestly before the pandemic, but now it's just really highlighting, like, just like the same way we would walk down the hall or we'd monitor a playground or we'd monitor transition times. Do we have school capacity to monitor in those places that we can social media to look for some concerning behavior? Also thinking through for both yourselves as the threat assessment team and for students, are there ways for them to remain safe and anonymous? I wouldn't want to pick up my phone, my personal phone, and call that dad when I just saw that his son had a weapon and for him to have access to my personal phone number. So do we have ways, and do teachers know ways that they can feel safe, and students, sorry, teachers and students know ways that they can feel safe and anonymous if needed? Also, again, thinking through what does that two preferred interviewers or at least one on standby look like? Also, virtual class assignments. There hasn't been much research on this and I'm interested to see what it looks like, but we used to know sort of the hallmarks in physical assignments. If students had journal entries or if students made certain drawings that would indicate, okay, this one we might need to pull them in and do a threat assessment. Virtual class assignments look different than our traditional paper and pencil and other types of assignments. So we're going to have to develop a whole new skill set and a whole new research base around what does threat look like in virtual assignments and what are those hallmark indicators that we used to have mastery of. And then also, again, having safe words, having other ways for students and staff. You know, we never know who's behind the virtual background. We never know who's 2 feet away threatening students where we can't see them and hear them. So do we have mechanisms so students, again, can be safe and so that we can assess their privacy and confidentiality? So some behaviors of concern, I've talked through some of these already, that we should be mindful of: social media posts, engagement with virtual communities that encourage violence. And so if we see the likes on Facebook from our students and they like some extremist groups and some of those things and they're commenting and engaging in those communities, if at school we saw them physically engaging with certain individuals, that might initiate a threat assessment. So we have to rethink, okay, again, if they're hanging out virtually, if they're hanging out with extremist groups or something, what does that tell us in our threat assessment process? How are we going to appropriately work with those threats, bullying, other comments made during classroom sessions or other sessions? Again, we're all going to have to take a huge look at our cyberbullying policies and instruction, and then look at students who, you know, again, thinking about behaviors that might look different or new. It's kind of a new thing, or at least it's becoming a more accepted thing, even if it's not new, for students to be talking about resentment, not just about the pandemic and having to be by themselves, but about other inequities, other political and societal influences. And are we talking about that in an engaging way, or is it really something that we should be concerned about as a threat assessment team? Context to be thinking through. I hope that we're all sitting down and thinking through, okay, who had some concerns before the pandemic? Who were we monitoring? Who was receiving certain levels of supports? I hope we're becoming familiar with online symptomology and what that may look like. I hope that we're being mindful of symptoms of depression, anxiety, suicide, substance use, and those types of things. We don't always know, but when we talk about mandatory reporting in just a moment, we're going to round out with that. Do we know about students who already had issues of domestic violence, and should we be checking in with them more? should we be looking into those, giving them different avenues than our traditional ones because we already knew they were exposed to those. And then to the extent that we can, just triaging, just doing what we do in our mental health work, in our multi-tiered systems of supports, to be thinking about students as individuals and who do we know has some significant family stressors, community stressors, and how can we provide some preventative resources and some interventions towards that end. So I think this first bullet is obvious, is that many of us already know who had those mental health concerns, and we've already seen those students who've shown us some increased symptomology, and that's great. We had some history and we knew about it, and so we've been better able to work through that in virtual space and attend to their needs. What's interesting and kind of unique, I think, to the pandemic is that ones that would have never been on our radar for suicide or threat assessment are the very ones that are here. So the ones that were most connected to school, most active, our valedictorians, our student council, our head athletes, all of those people who, if we were in physical space, would have never had concerns about, are actually the ones who are now, in some research is indicating, higher on the radar, because being away from school impacts them differently than the students who didn't want to be there in the first place, right? Like we used to be concerned about the students who didn't want to be at school. Now, as we're thinking about behavior and suicidal risk assessment, we have to think about which students is this impacting the most? And often it was those students that were most connected to school. And I just think that's an interesting twist and an interesting way to look at things, that those students that would have never been on our radar are now the ones that might need our most attention and access to resources. And you'll see it. I mean, those are the ones that were writing letters to the editor about, let us go back into school, and you took away band and that was my life, and you don't understand how much this basketball championship meant to me. And so it's important that we flip our script a little bit and think about those students who were most connected might be the most affected by not having those physical relationships, activities, and connections to school. And then, of course, other things to be thinking about are who are those students who are at home by themselves, those 5-year-olds, and both parents work. And so they're at home and less likely to have supervision, physical supervision, which is a threat to safety, but also supervision on their devices. And if they have nothing else to do but get on their tablets all day, and predators are very good at finding those kinds of kids, by the way. If you haven't increased your capacity in human trafficking and some of those issues, now's the time to do that as well. I think, Trisha, we're attending one today, aren't we? A human trafficking meeting. And that human trafficking is very heavily influenced in virtual space now and towards very young children. And then again, we spoke to which of those students have decreased access to protective factors. So I hope what a lot of this is compelling you to do is what I think school psychologists do more naturally anyway than other educators, and that's to be looking through this in a proactive rather than through a reactive lens. And so there's some things that we can be doing proactively to be supporting students, and some considerations to be thinking about ahead of time so that we don't have to get to a credible threat before we're giving students help and support. And we don't have to wait until an incident happens to know how we can support students. So I want you to be thinking of some of these things through that preventative, proactive lens, so we're just not waiting till those threats are made. You might say, I have no idea which variables to look at, Erika. You're just throwing all of these things at me and I don't know how to do it. Well, part of this document that Dr. Conley and Dr. Reeves took us through, of course, you know, NASP loves their checklists and their ways to try to help support you. And so the acronym that this particular assessment uses, TOADS, and it takes you through, again, it's a scripted, it's kind of a checklist protocol type of way to look through the most important considerations, the most important behaviors, the most important contexts, to lead you to the determination of if a student is low, moderate, or high risk. So I'm not saying all of these hard to talk about things and depressing things without trying to leave you with there's tools developed. You don't have to start from zero to help you in this work. I already spoke about, I would get your law enforcement and your mobile crisis teams or whatever your protocol is, and I would bump back that threshold. If it used to be, if it's a moderate threat, we're going to monitor for a few days. If you feel like that a person is at a moderate or higher threat, that now might be the time where we initiate our other resources, whereas before that was kind of our last and final resort. I think it may be sooner, just as a protection to those students and quite frankly, as a protection to ourselves as well. I'm excited to see what we come up with in terms of, and what some have already come up with in terms of progress monitoring and virtual check-ins, and what do those interventions look like? How did we change check-in, check-out? How did we change support for students who are showing concerning behaviors? So just being mindful of those and keeping your eye out. And linked with that, of course, we wouldn't be monitoring data if we weren't also providing virtual community and social supports for students. So shoring up our intervention and progress monitoring processes. We're going to really have to think through again that disciplinary action. There was a case in a different state where a student was essentially excluded from the classroom and the teacher kicked him off. That was the protocol. She was following what their school discipline policy was, and that made him so upset that he did show up to her home with a weapon. And so we were already talking pre-pandemic about restorative practices, and is punishment really the best way to deal with some of these behaviors, even though they are extreme? And I think there's room for additional discussion here for what does discipline look like when kids are already isolated and when we can't keep an eye on them. Also, having those hard conversations with parents. It was always hard to bring them in and say, look, I know that you guys go hunting, but I'm so concerned about Trisha. I feel like we need to lock those up for a while. I think you need to check in on her some more. But how are we still having those difficult conversations virtually and in a way that's just as meaningful for caregivers who are helping us with some of those behaviors? Not just helping us, they're sometimes the primary person, because we don't see those kids at school. So we're asking parents to take that on. And then I would be remiss to not talk about how then do we protect the victims of threats and manage their fear. So there's often more than one person. There's the person making the threat, and there's that teacher or student or group of students who feels threatened. So how are we creating a safe community for them after the threat? Are we addressing the cyberbullying? Are we giving them resources to learn how to block students who are bullying them, or do other pieces to protect and manage their fear? Okay. At the end of the day, I think we can see that that results in additional resource and training and skill acquisition for us. And again, not something you have to do tomorrow, but something to keep on your radar, especially if you are heavily involved in these threat assessment teams, or if you feel like you will be. Okay, I'm right at the 15-minute mark, and I want to leave some time for discussion. Not that you guys have been super chatty yet, but just in case. To round out our discussion, I did just want to bring up some considerations around mandatory reporting. And I was asked to do some trainings for some virtual schools and some other schools this year on this topic. So you guys are mandatory reporters. I hope you know that. But if you didn't, you are a mandatory reporter, as is all other educator in the state of Oklahoma, as well as any coach, volunteer, or person that works with children. And mandatory means mandatory. So we don't have the option to choose not to disclose abuse. And that's federal and state law. And many of you also probably have local district level policies. And sometimes it feels funny that I have to say that, but I have to say that because I do think some people view it as an option, or they don't understand it's a legal requirement for you to report abuse. And I'm not blaming anybody, but I'll talk to groups of teachers and others who are like, oh, I have to do that? I thought just the counselor did that. So I'm saying that to you so you can pass on the message, and that you can know that not everyone who is a mandatory reporter understands the weight of it, and that they are compelled by law. And it's not just reporting when a child has been abused. It's if they were abused in the past and you have suspicion about it, or if you feel like they will be. So it's not just current, it would also apply to previous abuse or the danger or threat of future abuse, okay? Here's the other thing that's hard is you don't need proof. We're not the jury, we're not the judge. We're mandatory reporters. What they ask us to do is report. And then it's somebody else's job to be the cop, to be the jury, to be the judge, and ultimately what I like to be the support. A lot of times DHS calls don't result in Micah getting taken away from her kiddos and her husband and her safe place. It results in someone brings attention to Micah's needs and she's connected with supports. And I don't think people realize that. The intent is for support, not just getting folks in trouble. On the other hand, there's some people who need to be in trouble and who need to be taken away from their kids or placed elsewhere. So it does serve that purpose, but it also serves the purpose of providing resource. So anyone who witnesses abuse, if the child tells you, and that would include all of the different forms of abuse, if you see suspicious, and notice it doesn't say proof, suspicious patterns of behavior, and even sometimes just a boundary violation. So an example, and it's not a pleasant one that I give, but an example one time when I had to make a call was when a student knew a lot more about anatomy in terms of what it looks like, what it feels like, what it smells like, than a child of that age should know. A 6-year-old shouldn't know certain intimate details about anatomy. So sometimes it's just something like that, like this doesn't seem right, that they know that. Another one is I had a 12-year-old one time who knew the color of the janitor's underwear. You shouldn't know that by any stretch of the imagination. So any of those types of things. Here's why it's critical. And here's why we talk about it today. And I think you guys may have seen this in the news, but calls to our own Oklahoma, DHS, and around the country have decreased by 50%. And I think some people thought, oh, good news, kids are with their families, so they're not being abused. But what we know is that isn't true. What really happened is kiddos aren't in schools. Teachers, education professionals, bus drivers, those that had their eyes physically on kids are usually the reporters. So when we took them out of schools and took them out of places where people could physically see what was happening, people weren't calling. On the other hand, though, emergency room doctors say that the increase in severe cases of child abuse that there's been a severe increase in cases of child abuse. So it's happening more and it's being reported less. And beforehand, before the pandemic, you would ask teachers, well, why didn't you report that? And I say teachers, you would ask educational professionals, probably to include school psychologists, why didn't you report that? I didn't feel like I had enough information. I was worried that the family might get mad at me. I thought the counselor was going to do it. I didn't have time. DHS never does anything anyway. I don't want to be the one to break up that family. So there was all kinds of reasons, none of which outweigh the law that we're compelled to call it in, and other folks can figure out the rest. By the way, these slides, I do have like a half-day presentation that Trisha's going to give you access to, and you can change it and use it in your school, or we can come out and do it. But we've done it a few times in the last few months, and teachers have found it beneficial. Okay, so virtually, what should we look for? So to the extent that we can, and this was true pre-pandemic, a lot of times you'll see the students' injuries on neck, near their ears, or other patterned responses. So clearly, if you see indications of abuse, also if you see indications of neglect. So it's one thing, as you guys saw my messy bed back here, if I didn't have on my background, but if you see that there's no food in those cupboards and there's rodents running around, or you see other issues that make you suspect neglect, that would also necessitate a call. You don't have to be nosy, but if you hear or you see concerning things in the background, it might be that Trisha is engaged and talking in class and it's all fine, but dad's sitting behind her on the couch without any clothes on, passed out drunk, and you can tell that he hasn't paid attention to her for 3 days. So it's okay to pay attention to what's being said and what you do see through the virtual space. By the way, you're a mandatory reporter, not just in school, but all hours of the day. I've seen abuse in a grocery store, and I know that I'm a mandatory reporter, and I had nothing to do with school. It was on a Saturday. You're a mandatory reporter 24 hours a day. So if we're going to call when we see abuse in a grocery store, then we should be able to call if we see abuse or neglect through the virtual screen. Of course, looking for concerning behaviors the same way we would if we were in person, about complete lack of participation, decline in grades, all of those things. Again, a call to DHS just says, I think somebody might want to check on this. Students who decline to turn on cameras or who turn them off when certain people walk in the room might be an indication. And then again, just making sure we're monitoring social media, because that's where kids, some research indicates that's where kids are disclosing abuse more so than going directly to a parent, a trusted adult, someone at school. So that speaks to that component of we need to be trying to monitor virtual space as school professionals. We've already talked about creating ways for students to report their concerns for themselves or others. So through private chat, make sure they're still having access to counselors and school psychologists and others, having those frequent, deliberate reminders and instruction about how to seek help. And at the end of the day, you and those that you work with, just if you suspect something's wrong, always better to report, always, always, always. Yeah, but I didn't see any physical signs. The child said it didn't happen. So I wonder if I should believe them. I don't have proof. I don't know exactly what happened. I don't know if I can believe what I'm seeing. I don't know if this is my business. None of that matters. If you're suspicious, if you have a reasonable suspicion that child abuse might have, maybe is, or maybe will occur, you're not the judge, you're not the cop, you're not the jury. You always, always, always err on the side of the child. It's better to be wrong than to be right and have had nothing happened. So as school psychologists, I would say, you know, it's up to us just to help remind teachers, especially again, now that we're kind of getting our feet back under us, we're still mandatory reporters, and we have to report even if we're looking through a computer screen. You might talk about indicators of abuse in virtual spaces and what disclosure might look like in virtual spaces. Make sure teachers know how to report, that it's safe to report, that they must report. On that presentation I gave that you guys can access, I have a whole list of do's and don'ts that you might find useful. Just reminding them that failing to report, I mean, sadly, you won't get in trouble if you report and you were wrong. If that's what you're really worried about, is getting in trouble, you won't get in trouble if you report and you're wrong. You might get in trouble if you didn't report and there was abuse. And to me, it should be about the kid anyway, but I understand that people have some personal considerations for reporting. And then just going over frequently asked questions. So this would be something that really, you know, quickly at their virtual PLCs and your team gatherings you could talk about, or certainly something as you guys are supporting your staff in buildings in terms of professional development or pre-service learning. And this is another place where you'll want to make sure your policies and procedures are up to date so teachers and others in the school know who to call. Okay, a couple of closing thoughts, and then maybe we'll have a minute or two for questions. At the end of the day, I hope that you see that virtual learning isn't going away. I hope we're all pandemic free in the very near future, and that we're not all forced as a nation, as a world, to go undercover again, but virtual environments is part of education now, and part of how we're going to be asked to deliver our services. So we need to be mindful of our skills and of our procedures, and to the extent that we're involved with PBIS teams, threat assessment teams, suicide risk assessment teams, to the extent we're able to do professional development and skill building, promoting these practices for not just ourselves, but for the teachers and staff that we serve as well. I'm going to say we all also know, in addition to lessons about virtual learning, that we really need to be mindful as we're developing these procedures. What a great time to have the conversations about equity that we've been needing to having, and about trauma, and about positive school cultures, right? Like maybe we can throw out some of these disciplinary procedures that we were attached to in threat assessment. Now's our opportunity to say, we knew they were bad before the pandemic, but now let's look through it through equity and restorative discipline and some of those other pieces. And of course, as I've thrown a million things at you, just being mindful that we need to support ourselves and each other as a community and other staff, and care for the caregiver. And that self-care needs to be at the forefront of what we're doing as well, because this work is hard. And every time we think we're caught up, here comes something new that we have to learn or change or work with. So we need to be caring for ourselves and for one another. I'll also just end by saying, I hope you don't feel like you have to recreate the wheel. I hope I've given you at least some places to start in this journey. And I'm happy to provide more consultation, more tools, more resources, as is Trisha. You're not going to have it all in place by next week or maybe by next year. So just build on what you have, prioritize what's important for your school community, and then give yourself, as the awesome school psych professionals that I love and adore about each of you, give yourself some grace and give your team some grace as we move forward in our new spaces and in what education looks like. Again, some of these procedures are talked in more detail on the NASP Ask the webinar series, and NASP has, of course, resources on just about everything. So visit their site daily. And this is just a final call that Trisha and I are at the State Department in our role. We are crisis team school psychologists, and our entire role is to support school professionals in their crisis management. And everything we talked about today falls under that. The QR code is to our website. The number in red is our crisis line. Now, it's different than like a suicide hotline. If we got somebody calling us who was suicidal, we could work through that. But it's meant as a support for school professionals. So if you hear of a crisis, if your district experiences one, if your neighboring district experiences one, if you've got something on your hands you need some support with, call us. I monitor the phone. Here it is. But you can call us. So save that in your phone and save the QR code. And we're here to help in the preparedness piece, response, recovery, your policies, all of those pieces is what we are here to support. So we do training and technical assistance. We've had, I think, 62 responses since we started in January of 2020. If you just need a resource emailed to you, we'll do that. You need us to get on Zoom with your crisis team, we'll do that. You need us to drive out or to mobilize a team and physically join you somewhere, we'll do that. Our motto is as little or as much support as needed. And that's just a picture of our larger team. So we do have people at the State Department who are trained in prepare and crisis response. So Trisha and I both live in the OKC Metro. If we can't get to you quickly, one of these folks can, and they're all ready and prepared to help as well. We're going to give you guys, I don't know if you have this, Trisha, I forgot to put it on the list. Here's a PDF that you guys can print, you can hang. You can send out virtually to your teachers, to your staff, but this is just kind of our calling card for how people can reach us. And here's our individual emails, phone, and again, access to our website. So I do want to just quickly say thank you to NASP and to the work of our partners, and thanks to Trisha, who's my partner at the State Department, and others who've done this work. Trisha, are there questions or discussion to be mindful of?
No questions, just some praise. And then I dropped the link to the evaluation in the chat box, and the password is safety. So you need to complete the evaluation, and then we will cross-reference that with our Zoom attendance list, and you will get CPD sent to you in your email. And then also there was a question about the resources that were provided, and we will send the resource folder along with that CPD credit certification.
So 1.5 hours of CPD, and it was recorded for your reference later if you have others you'd like to watch. Trisha, you want to talk about these upcoming events before we log off for today?
I was afraid that the meeting would end at 12 immediately, so we have a little time. I also put the links in the chat box for the evaluation eligibility handbook discussion that is on April 23rd at 9 o'clock in the morning. So there's a link to sign up in the chat box. There's also a link for to go to our conference registration page. The conference registration is still not open as of right now, but it will be very, very soon. So keep looking back to register for our conference. It is a 2-day conference. Well, it's a 1-day conference unless you are going to go through the Prepare Workshop 2, which then it will be a 2-day workshop, two-day training for you. That is on May 6th and 7th. And the communications committee is going to be posting some more details about those different options for the conference later today. It'll include the time, the price for members, the agenda, what it kind of looks like, what are the available options to go to. So keep an eye on our Facebook page and our Instagram page for those graphics to look through that agenda. And there's a question in the chat box. Is this prepare training the most recent edition? And it will be. So Dr. Olinger and myself will be presenting it. And it is the 3rd edition of workshop 2 for you.
Also, if this crisis work is as important to you as it is to me and Tricia, or if it's just something you want to know more about, sign up early, because we're only taking 20 people for physical distancing reasons into the Prepare 2 workshop for the spring conference. So only 20. So if that's something you really want to do, sign up early. Also know we'll just come to your district and do it with your district as well. So it's 12:02. I'm sorry I kept you guys 2 minutes late. I'm going to hang out for a few minutes unless there's questions or concerns or conversation. Otherwise, please feel free to log off and enjoy this beautiful weather and a nice weekend. And hopefully we'll see you on the 23rd or at the conference. So thank you so much for your time and attention, and happy Friday, everybody.
For those of you still on the call, I did put in the chat box the link to the webinar that's going to start